Hello everyone, my name is Donna Aquino and today's theme is about orthodontics. It's story time. Orthodontia is the study dealing with the prevention and correction of abnormally positioned or misaligned teeth. The dentist specializing in this practice, the orthodontist, is a graduate dental student who has completed an additional 2 to 3 years of study in orthodontics. Centric relationship is the most retruded position of the mandibular condyle into the glenoid fossa or biting on the back teeth, also known as the terminal hinge position. These are the classifications of malocclusion. Number 1 is the nutriclusion or class 1 condition in which the anterior-posterior occlusal position of the teeth or the mesiodistal positions are normal, but the malocclusions or positioning of the individual teeth occurs. This is an example of a class 1 malocclusion. Next is the distoclusion or class 2 condition in which the mesiobuccal cusp of the maxillary first molar is anterior to the buccal groove of mandibular first molar, and there is a appearance of a retruded mandible like in this picture. There are two divisions of class 2. Division 1 is the maxillary incisors protruding with a V-shaped arch instead of a U-shaped arch, and there is an overjet present like in this picture. Next is the class 2 division 2 or maxillary incisors having a lingual incline with an excessive overbite and wider than normal arch like in this picture. Last one is the mesioclusion or class 3 condition in which the mesiobuccal cusp of the maxillary first molar occludes in the interdental space of the mandibular permanent first molar's distal cusp and initial cusp of the mandibular permanent second molar, and there is an appearance of a protruded mandible like in this picture. An individual tooth position can be also classified as the mesioversion. Our tooth is positioned more mesial than normal. Distal tooth is more distal than normal. Labioversion. Labioversion is anterior tooth position outside the arch towards the lip, like in this picture. Buccaversion, posterior tooth position toward the cheek. Linguversion, tooth is positioned inside the arch towards the tongue. Inversion, tooth not fully erupted or into space. And supraversion, tooth over erupted. Torsiversion, tooth rotated on its axis. And transversion, or tooth is in wrong order. Causes of malocclusion. It includes trauma, habits, poor mouth conditions, or congenital present at birth factors such as supernumerary, excessive amount of teeth, or ectopic, abnormal position, eruption of the teeth. Some occlusion problems is number 1, the open bite. Anterior teeth do not contact with each other or no contact exists between the maxillary and mandibular posterior teeth. Next is overjet or horizontal overbite. Increase horizontal distance between the incisal edges of the maxillary and labial surfaces of the mandibular central incisors. Next is the vertical overbite, and it means that it has excessive amount of overlap of the maxillary and mandibular central incisor when they are in occlusion, like in this picture. Frostbite, mid-sagittal alignment between the central incisors are not in agreement. Underjet, maxillary Incisors are lingual to the mandibular excisors. And last is the end-to-end, which means edges of the maxillary and mandibular incisors meet with each other. Types and methods of orthodontic treatment. Preventive orthodontics. Procedures taken to preserve the integrity of a normal developing occlusion by protecting current conditions or preventing situations that would interfere with growth, such as correction of caries, poor nutrition, elimination of habits through myotherapeutic or muscle healing treatment exercises, or by the placing of space maintainers in areas of missing teeth. Interceptive orthodontics is procedures taken to lessen the severity of any existing malfunctions or problems from genetic or environmental factors, such as placing of use of appliances to correct improper growth patterns. Corrective orthodontics procedures taken to reduce or eliminate malocclusions. Treatment plans include the application of intraoral and extraoral appliances, auxiliary forces for tooth direction. Some movement forces are rotation, turn around on an axis, altering the position of a tooth around its long axis. Translation: bodily tooth movement, a change of teeth to alternate positions. Tipping, change of a tooth position to a more upright direction. Intrusion, movement of the tooth into the alveolus. Extrusion, movement of the tooth out of the alveolus. Torque, movement of the root without the movement of the crown. These are the types of corrective orthodontic treatment: banding, placing a metal band around the entire selective tooth or teeth. Brackets, tubes, hooks, springs, and other devices are placed on these bands and are used to attach, pull, push, pressure to the teeth movements, and arch wire shaping. And direct banding, cementing brackets of stainless steel or gold-plated metal composite, ceramic with metal centers, or monocrystalline sapphire. Clear brackets on surface of the tooth to attach needed pressures, and arch wire forms like in this picture. Indirect banding, placing and cementing brackets to tooth surfaces by means of grade delivery in Vaseline braces, strong plastic polyurethane, custom trays used in mild malocclusion cases like in this picture. Lingual braces that are placed on the tongue side of the teeth like this. Types of corrective orthodontic treatment: accelerated osteogenic orthodontic treatment, surgical orthodontic team approach that involves placement of a regular orthodontic apparatus on the teeth and a periodontist or oral surgeon to incise the gingiva and expose the alveolar bone. Adjunctive orthodontics, along with the selective biochemical movement. Other procedures are taken to facilitate a proper outcome. Selective enameloplasty, or removal of enamel surfaces of adjacent teeth to allow increased space for movement is one. Occasionally, an existing tooth, a premolar on each side, is removed to provide ample space for movement of the other teeth. Orthodontic surgery. It is a combined skills of several specialists. Usually, the orthodontist alignment of the teeth is completed along with services of an oral maxillofacial surgeon to reposition jawbones, the prosthodontics to provide prosthetic devices, and the family dentist for dental care of the patient. This is an example of a before and after of an orthodontic surgery. Common orthodontic surgical procedures are open bite, space between the upper and lower teeth when the mouth is closed, retrognathia, receding lower jaw or weak chin, prognosia, protruding lower jaw, extending jaw, and temporomandibular joint dysfunction or improper TMJ movement. Requirements for diagnosis and treatment planning for malocclusion are patient medical and dental history, clinical examination, photographs, extraoral and intraoral, impression taking, and radiogram. An example of radiogram is a cephalometric X-ray. Cephalometric means measurement of the head, films per skeletal pattern, and possibly 3D ICAT cone beam. Computerized tomography for bone depth and condition. This is an example of a cephalometric X-ray.
Hi everyone, I am Nell Elaine Silvano and today we're going to talk about intraoral appliances and auxiliaries used in orthodontics. Treatment of malocclusion is accomplished by applying forces through an intraoral or extraoral source, or a combination of both. These are the list of some intraoral items used. First is the bands, stainless steel circles or rings that are sized and cemented around the tooth. Bands are supplied as maxillary or mandibular in varying sizes, and they may be supplied with or without brackets or tubes attached. Next is the bracket. It is a metal, ceramic, composite, or clear resin-holding device used to support and stabilize the arch wire in the mouth. Arch wire is the horseshoe-shaped stainless steel or nickel titanium wire that may be round, rectangular, or square and removable or fixed. Next is the buccal tubes. It is a support device soldered on bands into which headgear and arch wires are inserted. They also may serve as stabilization for elastics or power devices. Let's proceed to button cleats, hooks, eyelets. It is used for support and holding power devices, elastics, and wires. Ligature. It is a thin stainless steel wires used to tie on or attach arch wires and any necessary attachments. Ligatures are not needed for self-ligating brackets. Elastics. Sized latex circles providing various pull forces or elastomeric ties for holding. Auxiliary springs. It is a noble metal or stainless steel attachment to apply directional force. And last, the separators. It is a brass wire, steel springs, or elastomeric materials that are placed between the teeth to obtain space before placing the bands. Next is the types and purposes of headgear and traction devices. Many cases of corrective orthodontics require the application of external forces to obtain proper movement and alignment. These are the list of some related terms. Number 1 is the headgear. Device composed of face bow and traction. It is used to apply external force. Next is the face bow. Stainless steel external arch bow device that is inserted into the fixed molar tubes on the maxillary first molars. The open wing ends extending from the oral cavity are connected with the prepared elastic traction strap devices. The face bow is used to move the molars distal for more anterior space. Then the traction device, fitted, expandable device to be hooked onto a face bow after placement on the head. The traction device is custom made and placed to achieve desired movement of teeth. The illustration below is the example of orthodontic traction devices. First is the cervical traction device, then the second picture shows the high pull traction device, and the next picture is the combination high pull and cervical traction device. So what is cervical device? Cervical device circles the patient's neck and attaches to the face bow to pull in a parallel position to retract teeth. High pull device fits on top of the patient's head and hooks in downward position perpendicular to occlusion to retract anterior teeth and control maxillary growth. While the combination high pull and cervical device is the traction combining both forces. And chin device is placed on the chin, incorporates high pull and cervical forces, and is used to control mandible growth. And And last, the temporary anchoring device. It is a titanium alloy mini screw microplant device inserted into the interproximal bone to supply anchorage and attraction hold point. It is used to upright tilted teeth, open bites, and jaw movements. The image below is a Class 2 correction device that may replace headgear or traction wear. What is a Class 2 correction device? It is a spring bar that clasps onto the buccal bracket on one end and arch bar placement on the other. The pressure generated on the mandible is constant and provides movement faster than with headgear traction that is worn 20 or so hours a day and removed at times. Next is the assorted and specialized appliance and retainers. Each orthodontic treatment case is individualized for the patient. Devices and appliances are developed to accomplish a specific goal. These are the list of some related terms. First is the aligner. It is an Invisalign system of computer image and computer-generated clear plastic overlay trays used with milder cases of misaligned teeth. Then the activator. Appliance designed to guide, change, or alter facial and jaw functions for a more favorable occlusion position. Howley appliance is a removable, customized acrylic and wire appliance designed to maintain newly acquired tooth position that is worn at night and sometimes during the day. For the next slide, we have the Crozat appliance, lingual retainer, and orthodontic tooth positioner. Crozat appliance, removable appliance made of precious alloy with body wires, lingual arms, and a high labial arch wire. Molar clasps hold the appliance in place. Then the lingual retainer. It is a mandibular lingual bar with cuspid to cuspid cemented unions to maintain lower incisors in position. While the orthodontic tooth positioner is a customized mouth tray device constructed of soft acrylic or rubberized material surrounding the crowns of all the teeth in the jaws, worn by the patient to maintain the newly acquired tooth placement until calcification and positioning are assured. Take note that they are not adjustable and differ from Invisalign trays that cause movement. Next, we have palatal expanders. It is known as RPE or Rapid Palatal Expanders. It is a fixed appliance cemented to the maxillary molar teeth with the spring insert in the palate area. Next is the fixed space maintainer. It is a custom constructed appliance attached to the remaining teeth to hold a tooth pattern or to maintain space from the premature loss of a tooth. And a night guard, a removable plastic splint worn at night to lessen the harmful effects of patients' grinding of teeth. Next is the mouth guard. It is a removable custom-made plastic tooth covering piece worn as protection from trauma while engaged in sport activities. Next is the oral shield. It is a device that fits into the vestibule space between the teeth and the lips. It helps to train and maintain lip function by correcting habits, strengthening lip action, or correcting mouth breathing faults. And last, the dental appliances. Specialized mouth appliances for health disorders such as sleep apnea, thumb sucking, nail biting, and tongue thrashing. Let's proceed to the instrumentation for the orthodontic practice. Each practice requires specialized tools and instruments to complete assigned tasks. Some of the most popular orthodontic instruments are listed here. First is the band remover plier. It is used to remove bands from teeth. Bird beak plier, used to bend and shape appliance wires. Loop forming pliers. It is used to form and shape loops in wires. O or how plier. It is used to make arch wire adjustment. Three-prong plier. It is used to close or adjust clasp. Contouring plier. It is used to contour bands for concave or convex tilt. Ligature tying plier. Used to tie or bind off ligature wires and to place elastics. Arch forming plier. It is used for bending or holding dimensional wires. Then a stress and tension gauge. It is used to measure intraoral forces. Band seater. It is used to sit band onto a tooth. Ligature tucker. It is used to guide ligatures and assist with the bending of cut wire edges. Bracket tweezers. It is used to place direct bond brackets. Ligature cutter used to cut ligature wire intraorally or extraorally. We also have pin and fine wire cutter. It is used to cut or snip off ends of tied ligatured wires. Waynard utility pliers is used for placing arch wires, then anterior band sliter is used to shear upper and lower bands. Distal end cutter used to cut hold arch wire that was inserted into buccal tubes. Then the band pusher is used to push and sit bands on the teeth. Ligature director used to direct and place ligature wires. Scaler used to remove excess cement from bands and to direct wires, bands and elastic into placement. Direct bonding bracket holder used to hold direct bonds in position during placement. Edgewise pliers used to hold or adjust arch wire. The hemostat, it is used to carry or hold small objects. Bone gauge used to establish the height of the orthodontic band. Then the bite stick, it is used to help seat posterior bands. And last, the orthodontic protractor. It is used to make cephalometric tracing. Again, hello everyone. Thank you for listening. We are Aquino and Silvano.